Generally speaking, we see a number of surgeries that are the most prevalent. Shoulder surgeries, knee surgeries, and now I'm going to focus on the back. There's three types of surgeries that we typically see for our victims or our clients that have been involved in serious wrecks. The first surgery is something called a laminectomy. The second surgery is something called a discectomy. And the third surgery is called a fusion. So if you're considering which law firm to choose, ask any other lawyer if they're able to tell you what I'm about to tell you. And the challenge would be, I don't think they can do it because they don't understand back injuries like we do. One of the reasons that I feel that I'm equipped to talk about things with the spine and the back is because my brother is a spine surgeon. And so I have many opportunities to discuss these items with him, along with many other doctors that I work with in the field. And that's one of the things I would tell you. We work with the best back specialists in the country. And the only reason we work with these people is because if I had a back injury, these are the people we'd go to. So I mentioned a second ago, there's a laminectomy, a discectomy, and a fusion. But before doing that, I want to explain how the spine works. So this is a model of your spine. This is your pelvis. And obviously your brain and your head is up here. And it's color coordinated in three sections. The purple section is your cervical spine, which is your neck. The blue section is the thoracic spine. And the green section is your lumbar spine. Now, the colors are bones. They're called vertebrae. In between the vertebrae is a disc, and it's a jelly-like substance. So a bad example would be a donut filled with jelly, okay? Whenever there's trauma meaning a car wreck, and your spine whiplashes like this, the vertebrae are going to push against each other, okay? And if they push against each other, the disc could push out. Here, the disc is bulging, and it's bulging, pushing out. It hasn't broken, the donut hasn't spilled out yet. If it's spewed out, it's called a herniation. So, up here you have your brain, and in your brain has all your nerves that run through the spine. And although you can't see it, there's a canal that runs all the way through your spine, through your pelvis, and then to your legs. This is where your nerves are. Okay? When you run into problems with your spine is when this canal gets tightened or squeezed or narrowed. Okay? And if you have a disc that's pushing on one of the nerves, that's when you start to get problems. So these nerves, imagine it's a water hose. If it's being pushed on against, the water doesn't flow. And I can promise you, these nerves do not like to be touched. They get really angry when they get touched. So if you're having immense pain, radiating pain from your lumbar spine down to your legs, it's most likely because either the canal is being narrowed or one of these yellow nerves is being touched by a disc herniation, by a disc bulge, by stenosis. Stenosis is the narrowing of the spinal canal. Okay? So, what does the doctor have options for? First of all, they're going to recommend chiropractic care, physical therapy. Let's say that doesn't get better. They may order an MRI. They may try to find. The only reason to order the MRI, by the way, is just to find the pain. You're only treating with the doctor for the pain. So everything's focusing on the pain. So let's say the doctor gets the MRI. It's just another documentation to help the doctor determine where your pain's coming from. There's a number of injections the doctor could do, ESIs, rhizotomies, medial branch blocks. And these are all doing one of two things. One, it's helping you with your pain. And two, it's helping you locate where the pain's coming from. But let's say all of that doesn't work. The doctor recommends surgery. The three types I told you about, we're going to talk about now. So, the first type, there's a bone in the back of your spine. It's called a lamina. So the doctor will come in, minimally invasive, and this is your skin on your back. My hand is the skin on your back. He'll come in minimally invasive, and he'll remove the lamina. It's called a laminectomy. And they'll remove the bone. It's a bone. The doctor will remove that to create space in the spinal canal so the nerve cannot be touched and not be upset. That's one procedure. Typically, the laminectomy goes with something called a discectomy. And if you can imagine the discectomy, the doctor would come in, again, minimally invasive, and shave off the area of the disc that's either herniating or bulging. And the goal, again, is to stop the contact from the nerve root. Those are, I would say, less aggressive forms of surgery. The more aggressive surgery is called a fusion. Let me explain what happens there. The doctor goes in minimally invasive. They remove the disc completely. They put a plastic disc in your spine. And then they take nails. So imagine these red marks are nails. And they put a bolt here. And they bolt the two vertebrae together. This is a much more aggressive type of surgery. And what happens, I don't want to scare you, but this is science. What happens is something called adjacent disc disease. So these vertebrae and your spinal cord likes to be able to move. In a way, we're like snakes. It doesn't want to be stiff. So whenever you have a fusion, you have less range of motion. And so depending on your age, depending on your health, you are likely, or it's possible, to have a fusion above and below the area of the fusion. It's called adjacent disc disease. And one of the things that we take our clients' cases to the next level is we make sure the spine surgeon predicts or evaluates what a second fusion would cost into your medical records. Why? Because if you have one fusion, there's a possibility you'll have others. And if there's a possibility you'll have others, we want to make sure to compensate you for those damages, for those injuries. And most firms, I can tell you honestly, are not doing that. They're leaving a lot of money on the table. And that's why you should hire my firm, because we're not going to leave any shortcuts. We're not going to leave you high and dry.